incubation period, transmission, clinical signs, gross lesions, prevention and treatment methods. It's an acute respiratory disease, affects nasal passage in growing cheeks and layers, causing great economic losses because of increasing number of cults and market reduction from 10 to 40% in egg production. Etiology. The causative agent of this disease is a gram-negative bacteria called Haemophilus paragallinarum. This bacteria is killed at 27 degrees centigrade for 1 day. Therefore, it spreads in winter season. Incubation period. It varies from 1 to 3 days. Transmission. The disease spreads from bird to bird and flock to flock by contact and air contaminated with dry nasal discharge and via drinking water contaminated with nasal discharge of infected birds. Clinical signs. The main signs are inflammation of eyes and nose, causing conjunctivitis and foul-smelling mucous nasal discharge, which mix with house dust, causing closing nasal holes, causing facial edema and swollen wattles. Feed and water consumption is decreased, leading to loss of weight in broilers and growing birds. Market reduction from 10 to 40% in egg production in layers. Gross lesions. There is no characterized gross lesions in the internal organs, but there is an acute catarrhal inflammation of mucous membrane of nasal passage and sinuses. Also, there is a catarrhal conjunctivitis and subcutaneous edema of face and wattles. Prevention. In the epidemic regions, polis and replacement flocks must be vaccinated with dead Coryza vaccine subcutaneous injection at the age of 10 to 20 weeks, 2 times with 3 weeks intervals. Ventilation in the crowded houses must be good, and the relative moisture in the open or closed houses must be suitable. Treatment. For treating the affected birds, we can use any method of the following. Sulfaquinoxaline or sulfadimidine by the rate of 1 gram per liter water, plus vitamin A3E by the rate of 3,000 to 5,000 units per bird for 3 to 5 days. But we must be careful because of bad effect of sulfa on kidney and egg production. Or streptomycin by the rate of 100 to 200 mg per chicken intramuscular injection. Or amoxicillin 20% or oxytetracycline 20% by the rate of 2 gram per liter water for 12 hours for 3 to 5 days. Plus potassium permanganate or any iodine compounds by the rate of 1 gram per 10 liter water for 12 hours. Finally,